Okay, welcome to a mini recording on the very end of Chapter 11. This is the portion that is over Medicare. We covered everything under Social Security in the last recording. So very briefly, there's just some basic things that I want you to understand about Medicare. Medicare, unlike Social Security, Medicare is unlike Social Security, Medicare starts at age 65, regardless of when you were born. So, Social Security full retirement age starts at, for some people it's 65, for some people it's 66, for some people it's 67, and you can elect to take it as early as 62. You can delay it until age 70. The Medicare starts at age 65. There are three parts of Medicare, and I do want you to memorize these three parts of Medicare, parts A, B, and D. Medicare is social insurance, and it's social health insurance for the elderly. Part A covers facilities, so it's hospitals and nursing homes, basically, and so inpatient stays, and it covers nursing homes inside. It covers nursing homes only after a qualifying hospital stay, and we'll get into that a little bit more. Part B is medical insurance, and this basically pays for outpatient services and the providers that are not associated with the facility, primarily the physicians. And Part D is prescription drug. This was enacted under President George W. Bush, I'm sorry, the second. So starting in 2006, these coverages are a little bit weird as they relate to insurance. Most insurance, health insurance, is part insurance and part payment plan. As insurance, what we want to do is we want to cover the tails, cover those things that cover the right tail, the things that would be financially catastrophic to us. And Medicare doesn't do such a great job of that. And it does an okay job as a payment plan, but it's structured very weird, and we'll see what I mean by that in a minute. So hospital insurance, Medicare Part A covers the hospital and skilled nursing care. Typically, this will be a non-hospital stay, again after a qualifying hospital stay, which is 3 days, and you don't have to go in immediately after, but within 30 days after, and as a result, generally of the same thing that you were hospitalized for, then you're required to go into a skilled nursing care. The deductibles, there's a deductible for Medicare Part A of $1,216. Somebody transcribed this wrong. It's $1,260. Now, you don't have to memorize these numbers. In my class, I give you access to this sheet, and I think this sheet actually does a better job of showing you what is of what it's covered. Medicare Part A, $1,260 deductible. And you're going to have that on this is, by the way, for the first 60 days. Again, thinking of a skilled nursing facility, patient pays the deductible. So you're on the hook for the 100% of upfront. That's typically how insurance works. There's a deductible up front. You're responsible for 100% until you get up to the $1,260, which you'll get to long before the 60th day of any hospital or skilled nursing facility stay. And then there is basically a copay per day of $315. The next 60 days, the patient pays $630. Now, that's not the next 60 days that's per day also, but that is not just per day. That 60 days is just a lifetime maximum above the 90. Now, if the next year the first 90 days can start over. So we have kind of a weird thing, and then they don't pay anything after that. So you can think of this as basically, you've heard of long-term care insurance, and we talked about that in the insurance class. This is basically short-term care insurance that only covers a short-term care stay basically with big holes after 60 days, and only covers the short-term care stay after a qualifying hospital stay. So not for every even stay that would be in a long-term care type facility or a skilled nursing care type facility. Okay, getting back to the slides. So and then the next period, and this just shows this basically based on a timeline. Deductible, again, $1,260. That's the total amount for the first 60 days, and then it goes on a per day basis to day 90. The first 90 days are per claim, or sort of per claim or per year, and then you have an additional 60 reserve days total in a lifetime. So there we see that. Medicare Part B. Medicare Part B, individuals pay the monthly premium, $105. Again, this is on the sheet that you have. $105 in 2015, so you don't have to memorize this. And then there's 20% co-insurance, and again, as I said, Part B goes to pay for things that aren't typically covered as part of the facility: the doctor services, and ambulance transportation, the tests, outpatient hospital services, and medical equipment and supplies. So this covers the other part of your medical bills. And look, we have a very small deductible, so 100% of the first $147, and then you're on the hook for 20% forever. So typically, most insurance will start off with, there will be some amount, and very often it's much bigger than $147, where you're on the hook for $100. And then we'll go into that copay period where there's some copay, where there's co-insurance, where you'll be responsible for some percentage like 20. But normally we want a max out-of-pocket or a stop loss, after which you don't pay anything. But this doesn't have that. Part A doesn't have that. Part A has this thing where you get to a certain period of time and then they don't pay anything. You're on the hook for all of it. So neither one of these, Part A is terrible catastrophic coverage. Part B is pretty bad catastrophic coverage. At least it pays 80% forever, but you're on the hook for 20% forever. So that could potentially, 20% of a lot could still be financially catastrophic. So there's definitely big gaps in the main Medicare coverages, Parts A and B. Now, Part D began in 2006. In order to elect Part D, by the way, so there's no premium for Part A, so pretty much everybody gets that. Part B, there is a premium for. Part D, there's a premium for. It is optional. But if you don't elect it, as soon as you're eligible to do that, again starting at age 65, for every month that you wait, it is a permanent increase in your lifetime premium for this benefit. So it is generally advisable to go ahead and elect Part D. So here's Part D. Part D is a little bit strange as well. So how does that work? you've got a $320 deductible. Let's start from reading from the bottom up. So the first $320 you pay 100% of, and then you pay 25%. So this kind of works like normal insurance until you get out to $2,960 spent on medical drugs, and then you go. And normally you would say that you would reach a stop loss and then you don't pay anything more after that. But no, that's not how it works. Generally, most prescription drug costs are not going to be catastrophic. There are some things that some certain cancer drugs can cost, $100,000 a year or something like that. And then again, trying to get that covered under certain insurances can be problematic. But now you're on the hook for even more after that $2,960 or about $3,000. And then we get to the point. Then we get to the point where basically there is this stop loss in coverage where there's a 40 after $4,700. There's basically a 0 to 5% copay that the individual pays, but the government covers the rest. So there's a max out of pocket. But there's this what's known as this donut hole between $2,960 and $4,700 from where you went to paying a significant portion, but still the government's paying most of it, to where you're potentially paying about half. So that's why this is called the donut hole. And I'm going to try something new that I haven't tried in a while. I'm not very good at drawing with a mouse, but I want to show you what I mean by the coverage. And PowerPoint has a drawing feature, so I'm going to try to draw what you would typically see in most insurance coverage, what we'd like to see, where I've got dollars that you're responsible for here, and then maybe I've got time over here, is that typically there will be deductible and you're responsible for, 100% of it, well, maybe up until it gets to a certain amount. And then you drop down and you're only responsible, this is dollars or percentage maybe. And then you're only responsible maybe for 20% or so, and then you're not responsible for anything. So you've got coverage that covers you for, it basically doesn't cover you anything in this first part, but then it covers you all of the difference here and everything beyond this point right here. So everything to the right of that and this whole gap area right here is covered. That's typically what we'll see in most insurance. Well, in Part A, what do we have? We've got this $1,260 that we pay, and then we pay a significantly higher amount, right? And then that's for like 60 days, and then we pay a lot after that for the next 60 days, and then we've got unlimited. We've got an unlimited amount that we can pay after that. So that is for Part B, and then for Part D. So this is well, no, that's what it should be. I'm sorry. This is normal insurance. This is most insurance. This is Part B, and then for Part D. Oh, I'm sorry. This is for Part A. I'm sorry. I'll do these in order. Scratch out Part B there. So this is for Medicare Part D. Is is that where we have it's kind of like the way insurance should work. We cover 100% for a little bit for only $147, but then we've got this thing that goes on forever where we have coverage. So basically, there's an unlimited amount because we have to pay 20%. So we start off by paying 100%, and then we go another 20%, but we pay that 20% forever. So that's coverage B. And then coverage D, we start off paying the first $320 or so, and then we pay 25% for a while, and then we pay 50% for a while, and then we go all the way back down here, not quite to the bottom, but almost, practically there, so to about a 5% copay. So we've got these gaps in coverage here. We've got these big gaps in coverage in terms of what we pay. So this is for Part D. So we can see that none of these work like we would expect normal health insurance to work, where we've got the deductible, and then we've got copay/co-insurance, and then we've got it where the insurance covers everything that's catastrophic. So it's a little bit goofy. This is what happens when a bunch of politicians have to start deciding how things work. So I wanted you to understand that there are gaps in this, and what we see is I'm willing to discard my beautiful artwork. What we see is that in the marketplace is that there's a market for something that's called Medigap insurance, and I wanted you to be able to understand how the gaps work and stuff like that. Okay, the only thing that we didn't cover, this is not part of Medicare, the only thing we didn't cover when we talked about Social Security, supplemental security income, that pays $733 a month for an individual, or $1,100 or $1,100. That's covered out of general tax revenue. It's not paid out of payroll taxes, and it is, just know that it's for the aged, blind, and disabled people who have very low income and few other sources of assets. So that's really it. The last two slides are about Social Security, and we talked about the benefits of divorce. We did not talk about this, that if you live in Cuba or North Korea, the government won't send you a check, but you can retire anywhere else. If you retire to Costa Rica, for example, or you retire to another place in the world, you can still get your Social Security check. Okay, so that wraps it up for Chapter 11. Be ready. Think about what the most important things you learned here, how you might apply that. Be ready to discuss it, and be ready to apply this and to understand what the coverage is given certain situations. And we'll do that in class. Do a practice problem in class on that.